Namaste. I am Dr. Tanweer Shahid. I am a consultant radiation oncologist and head of the Department of Radiation Oncology at Apollo Multispeciality Hospital. Today I am going to speak something about oral cancers. Oral cancer is a very common cancer in our country among the males, and most important thing about oral cancer is that majority of the patients, they visit to us in an advanced stage, and that really hampers the outcome of the treatment and also the functional ability of the patient, and ultimately leading to the poor quality of life. So today I'll demonstrate some very simple steps about awareness of oral cavity cancers to all of you. Today I am going to speak some very simple steps about oral examination, and specifically self-oral examination. And Dr. Chandrasekhar, who is my colleague, he has volunteered himself for this purpose. So he is Dr. Chandrasekhar. I will be demonstrating on him, but it is primarily a self-oral examination. To begin with, for oral examination, it's very important that you have to just follow some few basic steps. To begin with, you can start with the lips. Lips, we can all see on the mirror, the upper lip and the lower lip. Any abnormality on the lips can be easily detectable, so that is very simple. Now, moving on from the outer aspect of the lip to the inner aspect of the lip, and for inner aspect of the lip, we should just see the mucosa or the lining inside the lower lip. It is usually smooth and glistening. Similarly, the upper part of the lip and just underneath the lip, how is the mucosa of the lip? Anything abnormality in the lips has to be reported to the clinician. From the lips, we'll open the mouth. Chandrasekhar, can you just open the mouth? And we'll look at the tongue. So can you just protrude your tongue? So this tongue can be seen, and we just see the surface of the tongue. This is called as the upper surface or also dorsal aspect of the tongue. And similarly, beneath is called as the under surface or the ventral surface of the tongue. So these two can be easily inspected on the mirror while taking bath, or just after brushing your teeth. You can just have a oral examination of the tongue. Usually, if any ulcers or blisters is on the tongue which is not healing, or if there is white spot which has recently started increasing in size, we'll have to be cautious and we'll have to again report to the clinicians. So to begin with the lip, then we have gone to the tongue, and tongue also both upper surface, which is called the dorsum, and the ventral surface, which is the under surface of the tongue. So from the lip and the tongue, we move on to the cheek, which is also called as buccal mucosa. In cheek also, we have the left side of the cheek and the right side of the cheek. Usually there is a white line on the cheek, which is basically, it is at the intersection of the upper jaw and the lower jaw, which is absolutely normal finding. But apart from that, if any spots, specifically white spot, which is also called as leukoplekic patches, or it is also called small non-healing ulcers, if by chance with any loose teeth or something, that has to be very carefully monitored and it has to be duly checked in by the physician. So the lip, the tongue and the cheek. From the cheek we go back and we just see the back aspect, which is the tonsillar area. Tonsillar area is at the right and the left, which we can just protrude our tongue and press it a bit, and we can see the tonsillar part. If you see anything which is abnormal, you will have to be cautious for that. Then after seeing the lips, the tongue, the cheek and the tonsillar area, then we see the palate area, which is also called as talu, or it is basically palate area, which is a soft palate which is at the back, and the hard palate which is in the front. And the palate again has to be examined. It can be easily seen on the mirror without any difficulty. So we'll have to be cautious for that. So these are the organs which we'll have to see. Again, to revise: the lips, the external surface of the lip, the under surface of the lip. From the lip we have gone to the tongue, the upper surface, the under surface, then the cheek, the left side of the cheek, the right side of the cheek, then the tonsillar area, and finally the palate area. After examining these structures, it is a very routine. It takes hardly 30 seconds to 40 seconds or even less than that
but this awareness can really prevent cancers in many possible ways, because oral cavity, it has been made in such a way that a simple inspection or simple examination on a routine purpose can detect any abnormal features. And finally, when we complete this, we should be also cautious about the neck. If any neck swelling is there, either on the left side or on the right side, then in that case, and if it is not healing or if it is persisting, then definitely it is a matter of worry and it has to be reported. So the message is that a simple awareness technique of this kind can really prevent oral cancers in many possible ways, and that's the crux of self-examination of oral cavity. Thank you, Chandrasekhar, and thank you all. Stay safe, stay blessed. Thank you.